You're listening to the Two Sleuth Podcast, all about the business of dentistry, hosted by yours truly, Greg Essenmacher, a fixable arch dental expert and founder of G&A Consult, speaking with industry leaders on the dental landscape from their perspective. Welcome back, everyone. Two Sleuth Podcast, Greg Essenmacher here. I am super excited. I'm welcoming in a friend of mine. He's a newer friend of mine. Now, I knew him on socials and I met him kind of sort of last summer. So almost a year ago. It's none other than Dr. Rad. Dr. Rad, why don't you introduce yourself to my listening audience? Because some people know you, right? You're the sleep dude, but tell everybody who you are.
Yes, my name is Dr. Dar Radfar. I'm known as Dr. Rad because everything's rad. Your life is rad. My life is rad. We're going to make this episode super rad. Let's get deep a little bit. I dived into the world of sleep because in 2009, I fell asleep at the wheel. I crashed my car going about 30 to 40 miles an hour into a tree. Embarrassingly, woke up out of it, got not even a scratch on me. And I realized that I was more tired throughout the day. At the time, my bed partner was telling me I was starting to snore. And I was back then 32 years old. I was not overweight, not your classic poster child, so to speak, for sleep apnea. But I got a home sleep test because I didn't have time to go to a lab. So I found someone that was offering home sleep tests back then. And lo and behold, I have apnea. And they gave me a mask, which is not sexy. Couldn't wear it. It was uncomfortable because I turned from side to side and it made noise. And my bed partner was like, "Yeah, okay, cool. That's helping, but you keep waking up from it." And so a few months later, I saw that there's this mouthpiece called an oral appliance for sleep, and I became a patient of myself. I was patient zero. And since then, I've helped over 3,000 patients within my practice. A lot of them are from medical doctor referrals in my area. I've been passionately speaking about this and this journey of mine on stage since 2014. I go to dental conferences and I teach other dentists on how to do this. And I have now a coaching program that helps implement it into any practice. We had 6 figures in the first year if your flex is money. But more importantly, Greg, we save lives. 12 to 15 years off your life if you're not treated for sleep apnea and 5 times high risk of cancer of any kind. And rates of depression and anxiety and just feeling grumpy and just how are you supposed to have a positive mindset, manifest and be a good person when you have sleep that's interrupted with breathing alterations that cause your body to feel fatigued and tired and not replenished? You can't really sleep well and be a good human. You can't be a good human being if you can't sleep well. It's very challenging to have that positive mindset when you kick off and you enter a dental practice. So I've really dived into some personal development stuff. We were talking about this, you and I, before. I've been to Tony Robbins, Dr. Joe Dispenza, Jordan Peterson, Peter Crone, Danny Morell, the Kabbalah Center. I've done all the Kabbalah trainings. And it's just made me understand, Greg, how that's why you and I get along so well. And the people who are listening, if you want to have like a better life, it's such a cliche, and not be burnt out. It all starts within you to work on your triggers, work on the things that make you feel like you're not good enough, you're not doing enough, you're not collecting 3.6 million yet, like the other dentist down the street. Why? Why? And stop beating yourself up for it. And instead work on those emotions and those triggers through retreats, through podcasts and books. And that ultimately, Greg, will bring you back to a place where you're inviting things like doing sleep apnea or all on 4s, all on 6s into your practice that really, really help propel your numbers if that's what your goal is.
Well, it's something that you mentioned, right? So the mask. So I have to say, the first thing that came to mind is the old hair club for men. I'm not only the president, but I'm a client, right? So that's what was coming to mind for all of you that know me really well. It's like, man, can he pull out more references from the 80s and 90s, right? Because I do all the time, right? I grew up on television, youngest of 6 kids, live with it, folks. That's what, because I actually did have the sleep test and had the sleep apnea mask and just wouldn't wear it because I just couldn't adapt to it. And for years then suffered from And it was a while ago that I actually got a sleep appliance, a dental sleep appliance for my mouth that I wear every night. And my marriage has never been better in the last 7 or 8 years. My sleep's never been better. So I agree 100%. And, when people say, it's Dr. Rad, but your first name is Dar, and I can't help but think of Darth Vader with this huge mask. And it's just, it wasn't a tenable situation. And I travel a lot, that, right, for business. And when I see people carrying around these old school like machines as their third carry-on bag, I'm thinking, no, there's a better way. Like, I have somebody you need to talk to. But you honed in on something, right? And your journey before you had that incident with the tree, which thank God, like, you were uninjured at 30, 40 miles an hour, it's your partner had talked about it. And for us to be able to listen to others and do that inner work, that self exploration, and you talked about many of them, and that I'm actually doing some Kabbalah training myself, and just that inner work. And I've been sober 20 plus years, so I do a lot of that inner work, right? So whether it's through step work or whatever the case may be, just that self awareness alone. And many of my guests on the Two Sleuth, right? Vulnerability, authenticity have talked about this on their own journey. It emanates into every aspect of their life, whether it's business, personal, you name it, friendships, every relationship with self and others. And so I love that you really lead with that into your life and who you are and who you're becoming, because I think that's so critically important for people to hear, right? A number of our guests that have been on the podcast, right? From Kyle Stanley. And, I could go right down the list, talk about the white coat syndrome and the challenges. It doesn't have to be that way. Would you agree, my friend?
Yeah, the struggles that we go through, the struggles that we put ourselves through and think, woe is me, and this is happening to me. My staff member gave me 2 weeks notice, came out of nowhere. My hygienist didn't show up today. Now I got to do the hygiene myself. Or this patient wants a refund. Like, all these things are part of any business. It's really how you take it on personally. If you're taking things personally on everything that happens, whether it's your partner at home or your kids this or something at work, you need to handle the personal things. And the more we struggle, the more we grow. And I came to this country, Greg, at the age of 6 years old. I escaped through the mountains of Iran on horseback into Turkey. I was told on horseback to look for snipers. As me and the guy who helped us escape went about 500 yards, make sure the coast is clear, come back, tell my family, who were also on horses, my mom, my dad, my 9-month-old brother, and 2 other families. That responsibility was put on me at 6 years old. And I don't look at that as a woe is me victim mentality of I lost my childhood instantly and I became a responsible adult to save a dozen lives back there, which, by the way, I did find a sniper. I did show it to him, and we ended up paying him off to let us through the mountains and into, let's call it, liberation and freedom. And that moment, I always think of how I was able to persevere and push through every time I have a struggle or something come to me. There's the reason why these things are happening. And I just observe. I go above the clouds. I observe the rain. I observe the thunder. I observe the snow, the hail, even the sunny days, the beautiful days outside. And once we observe and we become a little bit less attached in our rage and our ego and our emotions towards these things that are happening in a dental practice, we have more clarity. We're able to solve and be that leader in our practices and ultimately attract more. You're going to have better things come in that day when you know how to handle the bad things that started your day.
Well, and you talk about your story as a 6-year-old and escaping the persecution into Turkey as you did. And for myself, right, 4 years old, my mother dies of cancer, my dad a raging alcoholic, and I could have chosen to live in victim mentality, which I did for a while, right? That's what I drank at that for a long time, right? And drugged at that until the age of 33. The choice to either be a victim or to survive and thrive, it's a choice. We have choices every single day. And I can even say well into sobriety, right? So there is still this less than I'm not worthy of. And there's still a constant exploration for myself. And so, I don't want this for people to hear and think, But you also talked about earlier, though, you're talking about like my office manager quit, suddenly, and this is happening in personal life. But even because I have a lot of industry folks that listen, it's like, oh, my sales rep, turned in their notice, is going to a competing company. Like, how dare they do that to me? How dare my friends I used to work with 10 years ago poach from my company? That's an opportunity for that pain you talked about to grow. What is it that we're not providing? And perhaps that's their path. I would be holding them back from where they're supposed to be, from where their path is taking them. Bless them and let them go on, right? Wish them the best, because I know for me, starting G&A Consult, where we help those full arch practices with the teach, coach, and train side of every touch point of the patient journey, and on the ops side to be able to become what they're trying to become, right? A lot of GP practices that have full arch as part of, some of the DSOs we work with. I mean, it's just been incredible how we've been able to grow. Like, a lot of, and I could play victim mentality for how, some of my career choices have been, but they've come full circle because I've done, not done, I am doing, let me correct that language, doing the inner work to be able to be open to in so many ways. And, it's just really a testament to, if we have the opportunity to, and if we put people around us that are doing that as well, right? There's a saying that you become like the 5 people you spend the most time with. And so I'm starting to be more mindful of that. And I see it happening with my husband. I see it happening with my friends group. And there's just some people who, people come in, I believe, into my life for a reason, a season, or a lifetime. And when I try to move people from the temporary to the more permanent is where I find angst and pain and anger at self. But I outlash at them, but it's really at self. And that's what I'm finding more and more today is it's like, why am I going through this? What is the lesson in this for me, not for them? Because I can't change them. I can only change me. Do you find that as well?
Hey there, it's Greg Essenmacher, host of the Two Sleuth podcast and founder of G&A Consult. At G&A, we specialize in transforming full arch dental practices, teaching, coaching, and training teams to deliver an exceptional patient experience, from that first call to delivering final smiles. Whether you're a practice owner, a DSO executive, or a regional leader looking to expand your full arch program, boost same-store sales, or unlock the true profitability of full arch cases, we've got you covered. Ready to see how full arch can elevate your practice? Visit the show page or book a discovery call today. Let's turn your potential into results.
Yeah, you're touching on something that when somebody gives you a bad news or information, whether it's an employee or a coworker or a patient, you have to have compassion from where that's coming from. The universe is A, trying to protect you from something, or B, it's trying to bring, even though there's going to be a short-term struggle, there's probably a better opportunity that's going to come. So that's why you have to pause with the trigger that you just felt. And I always teach my clients when we do teach about incorporating sleep, when you talk about the airway, when you bring the patient back and you see large scallop tongue, lower anterior wear, high blood pressure, acid reflux, history of heart attack, arrhythmias, all these things that go, oh, red flags. I need to talk about sleep. I go, Greg, when I had you back and I was looking at your teeth and the gums and everything, I was looking also at your airway. I'm a little concerned you're not getting enough air when you sleep. Do you feel tired throughout the day? Has anyone told you that you snore? My demeanor becomes extremely compassionate. Not, I need to sell a $4,000 oral appliance because our numbers are low. I'm saving this person's life, perhaps. I'm saving their marriage and their relationship from going into sleep divorce, which is they sleep in different bedrooms, but under the same household. I am going to make their medical history, their mental history, their dental history all better because of this conversation. And 7 out of 10 times, you're going to be told, nope, doc, I sleep great. I don't know what you're talking about. Are you trying to sell me something? I saw the Maserati parked outside. I know vacation season's coming up, whatever they like to throw. And I look at them and I go, I wonder what they've been hurt by that they're reacting in a negative way when I'm trying to save their life. and their relationship and
Right.
their. And so that's the point here. The point of having that compassion where you back up, you observe any situation, your employee leaving, your husband or wife criticizing you as you put 2 foot into the house, 2 feet into the house, and boom, you get the bombardment. It's like, what did they go through today that they're being not on the same wavelength as me? And my job and my duty as a practitioner, as a human being, as a father, as a partner, as anybody, is just to be as authentic and kind and understanding. And once you do that, the 9 or 10 things that become negative in your week become 1 or 2. And even if like in those 1 or 2 incidents that do occur, because the universe knows that they can't bring in Satan cannot come into your world when you're not accepting it, because you have the aura of compassion and kindness, and hopefully ultimately some sort of leading with love. This kind of conversation you have with a patient, I guarantee you your numbers will go up. When you sit there and you actually look at them and give them eye contact and give them that understanding of why they're saying no without being pushing back. Well, if you don't do it, you're going to die. You're going to break the tooth in half and you're going to need an implant. You're going to need a root canal. It's like, those are important information, but how can I help you to make sure that we do this procedure for you? What's hindering you? Is everything okay? That's a different kind of approach that we're not taught in dental school. We're actually not really taught in real life. But if you could do this at home, do you do this with your kids? Do you do this overall? Not every single, like every second. You're going to have to calm down your trigger and then lead with this compassion. You'll do it every day at work. And all of a sudden, work becomes actually a beautiful place.
Yeah, and what you're talking about, right, is the key, which is pause, right? And that's one of the biggest challenges when somebody does hit that trigger. And I love how you put the compassion piece, because I talk about showing grace to others. Because if I can show grace to others, then I can show grace to myself, and that really is one of the keys. And the piece that really I was honing in on, when you started to transition your tone, your voice, your language changed when you started talking as if you were talking to a patient. And we focus on that so much at GNA Consult. When you're talking about the consultation with a patient for full arch, it's not the what. The what is the product. And it doesn't matter what auxiliary service you're talking about, clear aligners, sleep, full arch. Doesn't matter what the what is, as long as you're delivering a good product. It's the why, it's the motivation behind it. And if you can tap into that and come alongside them and say, I want to help you. Now, are you going to get rebuffed like you talked about? Are you going to get the snapback? Absolutely. And is it going to happen 7 out of 10 times? Yes, but it's the other 3 that you need to walk alongside them. Not need, that you can walk alongside them, I should say, and be mindful of my words, right? That you can walk alongside them. And in that is really where the joy is. That's where the being of service is. That's where we can all, in this industry that most of us know and love, dental. I know I backed into it 18 years ago, and I don't know that I'll really leave, because there is so much joy in it. And in full arch, it's that patient reveal, that emotional, giving people back the ability to eat and chew and be able to have their grandbabies on their lap and be able to, eat a piece of pizza and not worry about the dentures flopping in the lap. I mean, all the things that I talk about being a grandparent, because my first grandson's coming in July. So I'll talk about that a lot in the next like umpteen episodes of the Two Sleuth. You'll all be hearing about that for sure. But that is that emotional connection that I think is so critically important, that it can be taught from whatever baseline level you're at. It can be taught. And that's where I think coaching can be so valuable for those. And even for coaches, up-leveling skill in your ability to transfer that and teach that and connect with. It's our responsibility to continually do the work internally in order to be able to show up better for our clients. And I think that's what's critically important for us to look at. What do you think?
Yeah, Greg, you mentioned having grace for someone else to have grace for yourself. I also look at it in the retrospect the other way. When you're looking at the mirror and putting your makeup on, or shaving your face, or you're ready to, you look at your bank account, you look at yourself, you look at your body, You have to have grace and acceptance for where you are. If you don't like something truly and it's really affecting you, take the action plan and change it, and make it happen. Don't sit in the place of non-action, which is more miserable than the place of action, which can lead to something beautiful. And it starts at home. If you can do this kind of work when it comes to compassion and empathy towards your partner that's triggering you, towards your kids, towards your mom or your dad who will never apologize, which you have to forgive everyone without an apology. Forgive everyone that you have grudges against in your past that have kept you in this cloud over your head without the apology that you were expecting. What a freedom that brings about to, hey, tell universe and source, I am accepting now of the good. Because I am leading like you, the source and the good. And that is the only way that out of the 20 patients you see on Monday, Tuesday, Wednesday, that out of the 20 patients you see, majority of them you're going to lead with compassion. You're still going to not be perfect. There are going to be ones that, I hate coming here, doc. I hate this. Oh, okay, Sally, and then nice to see you too. I completely understand the experiences that you've had that brought you here. But it's so nice to see. I'll do my best to make this as easy as possible for you. That's compassion. That's not me saying, man, this lady always says she hates me when she comes here. It's not about you. It's about the fact that she's had experiences that have not been good, and try to give the best experience possible. And you got the next emotional room to go into and handle that. And that then just becomes a part of you. It becomes a part of your life. You'll magnetically attract love, abundance, and financial, better health. You know how internally we are decaying if we're leading with that kind of stress and mentality in our lives, literally boiling. Our cells are not supposed to handle this kind of emotional aggravation and burnout and response. That's why so many dentists are stopping dentistry after a decade or two, because they feel bubbling inside. And honestly,
Yeah.
feel that still when it comes to certain procedures that I'm doing that are more critical and more pain intensive. When I do sleep apnea, it's like, doo-doo-doo. Yeah, it's like wow, just the most non-invasive, the most powerful thing you could do for a patient. And yeah, you want to do the medical billing, going to charge cash. I don't care. Whatever it is, you can learn that. More importantly, it's the impact that you can have that no other professional can make oral appliances besides a dentist. That's it. There's
Yeah.
no ENT that makes it. There's no hygienist that can make it. There's nobody else besides a dentist can make it. The hygienist is the pivotal, Batman and Robin situation where they'll plant the seed, and then the dentist is the one who executes. And it's such an easy thing. And that one procedure, I think, really does ultimately, you feel that heart-to-heart connection with the patient.
Yeah, and that attitude toward the patient who doesn't want to be there, right? That's complaining constantly. Both sides of the, just going to make the most of it, and the, oh boy, Sally's coming in again. I see that with our on-site visits with clients during the morning huddle of how they address it. And it starts at the top, and it's so fascinating to see. I love that. And you reminded me of when you talked about forgiving. Matt Kahn has a great way of framing it. And he says the word forgive is actually a part of an entire phrase. And if you want to change your framing of it, it's a part of the word forgive is a part of a phrase of thank you for giving me the opportunity to grow from this experience. And when I heard that and I implemented it with one particular person that I was struggling with about a year ago when I first learned this, and a good friend of mine, Chelsea Myers, turned me on to Matt Kahn and this fantastic talk he gave, it literally, I could feel the weight lifted. And anytime that I think of this person from that moment forward, there's no emotional attachment to this person. And it was so amazing. So I share that with you because I love you like a brother. Well, my friend, this is the part of the program all of my guests play a little something called What the Sleuth is Going On. It's 3 rapid fire questions. The first thing that comes to mind, are you ready to play?
Absolutely.
Question number 1. What's the worst bad breath you've ever encountered?
Huh. It was a group of men at temple during Yom Kippur, which is the Day of Atonement, and everyone was fasting. And I'm standing, no water, no food. It's 6 p.m., almost sunset outside where we could eat. And it was an influx of back breath from very old men within the community, within the
I
temple.
can so relate. I have many friends of mine who, honor the month of Ramadan and fast during the day. And by the end of the day, God love them all. I really, really do. But it is a challenge, right? Those that actually honor fasting during the month of Ramadan. So I hear you. And it is, when we're recording this, at least, I think when it publishes, might be right at the end. So there you have it for sure. Okay, question number 2. If you could change one thing about your smile, what would it be?
Uh, I would probably want to do more expansion, look like Julia Roberts, where when she smiles and you can see her wisdom teeth.
She does have that big smile. Especially, it reminds me, I just got a flash of her in my head, a Pretty Woman, and the snapping of the pearl necklace? That was a great scene. That and the snails. Woo, slippery little suckers. I don't know why. I just share with you, stream of consciousness. Love it. Question number 3. If you could go back and be the inventor of any dental product, I have a feeling I know what you're going to say, and no, it can't be your own. Which one would you choose and why? This is like a layup question. All of my guests have answered this 100 plus episodes, but go ahead. I'll let you answer. Go ahead.
So if I could go back and invent a dental product,
If you could go back and be the inventor of any dental product, which one would you choose and why?
I would have to make the sleep appliance.
Yeah.
That's me. For me, I mean,
I literally was getting ready to ask it, and I'm like, oh, I already know what he's gonna say. That's not right.
I could say, I invented an electric toothbrush, a water flosser, and those are all great. And oral hygiene is, I guess, important.
Those answers have come up. Yep. So in the 100th episode, we categorized them. Those were pretty popular. But yeah, I literally was reading that, and I'm like, oh, darn.
Yeah,
there's no way, Dr. Red. I know exactly what you're gonna say. I mean, that was a layup. It's layup question. Anyway, so my friend, in the last few minutes, I want to respect your time and my listening audience's time. Is there anything that I haven't asked you or that you haven't had a chance to share that you really want to make sure that you do with my listening audience and with me today?
Yeah, we talked a lot about personal development today, and some of the names I'd like to throw out, including the big names like Tony Robbins, are Peter Crone has been a pivotal part, Crone. Look these people up and on YouTube. Dr. Joe Dispenza and his meditation techniques. The Kabbalah Center has videos that can talk about it. It has nothing to do with Jewish, Muslim, or Christianity. It's a spiritual mindset. Danny Morell has been pivotal. I did breath work under him at his Awaken retreat. That bit was life-changing. These are the tools to be able to, that I actually incorporate in my coaching program at Rad Seminar. And if anyone wants any information, radseminar.com, you can send me a message. These are the tools that I incorporate along with teaching you how to do sleep, the medical billing portion, the home sleep test, and all that fun stuff. Because I do believe that when you have these type tools from these humans that will get you to the finish line quicker, you end up having a much more pleasant, happy, gratitude-filled, and abundance-filled lifestyle.
I love it. And you've shared some of that information. Are there other ways to get a hold of you that are easier? And we'll make sure they get in the show notes as well, because you've been just a plethora of information. And I think of just wisdom is the word that comes to mind instantly, for sure.
Yeah, my email is darradfar@gmail.com, my first name, last name. And then you can also just Google me, Dar Radfar or Dr. Rad, sleep. And you can find a bunch of ways to communicate through me through Instagram, through Facebook. I answer my own DMs. I get excited and I geek out on helping doctors lead better lives, helping save lives, and ultimately growing their practices.
My friend, you are a beautiful human being, and every time I have a chance to interact with you, whether electronically or in person, it is always a pleasure. Thank you so much for being a guest on the Tooth Sleuth podcast, and until we meet again, be well.
Thank you, Greg. Bye, everyone.
If you need help with converting lead calls into consultations, closing consults into more full arch cases, or creating a more strategic marketing message and branding for your practice or group, follow me for more tips or reach out to G&A Consult for a discovery call today.